Good evening, everyone. Hope you all are doing good. I, Dr. Ami Rawal, your original guru for dental anatomy and dental histology, is here with you today to have a discussion on most important previous year questions of dental anatomy and dental histology, right? So, let's start with our first question, which is an image-based question from dental anatomy. Now, some students had a confusion in this question, so please go through the image carefully. Identify the structure marked with a red line in the image given below, right? So here they have given a tooth and here we have a red line, right? This structure. So what is it? Is it a transverse ridge? Is it a buccal ridge? Is it oblique ridge or is it a marginal ridge? So they are asking about which ridge is shown in the box, red box, right? So some of the students had a doubt in this image. They thought it was, the image based question was regarding the oblique ridge, right? During the discussion, last year's question it is. But it was transverse ridge, right? Yes, I think all of you are getting it correct. Tanvi, Pratik, Nikesh, Simran, Ruby. So the correct answer here is transverse ridge. Good. Why transverse ridge? Because what is transverse ridge? Mainly, it is a union of two triangular ridges, right? It is a union of two triangular ridges. So here we can see from the buccal aspect and from the lingual aspect, from the tip of the cusp, one ridge is ending towards the central portion and the other from the lingual aspect also, one ridge is starting from the tip of the cusp towards the central, and union of both these ridges is our transverse ridge. So transverse ridge is mainly a union of two triangular ridges. Yes, Nami is also there. So mainly it is union of two triangular ridges. And what is a triangular ridge? It is a ridge extending from the tip of the cusp towards the central portion of the crown. Now coming to oblique ridge. So you can be asked about an image based question regarding oblique ridge, right? So what is oblique ridge? Oblique ridge mainly crosses the molars obliquely, starting from where? It is a combination of which ridges? So it is formed by union of triangular ridge of distobuccal cusp. Here we can see in this diagram, you can easily appreciate. Here we have triangular ridge of distobuccal cusp, but not the triangular ridge of mesiolingual cusp, right? Here we have cusp ridge, distal cusp ridge of mesiolingual cusp. So this is again an important MCQ question. Oblique ridge is mainly a union of what? Triangular ridge of distobuccal cusp and distal cusp ridge of mesiolingual cusp, right? So you can be asked an image based question regarding oblique ridge also. So don't get confused between oblique ridge and transverse ridge. Oblique ridge mainly crosses occlusal surface obliquely and is not formed by the union of two triangular ridges. It is mainly a union of one triangular ridge and one cusp ridge. So distal cusp ridge of mesiolingual cusp and triangular ridge of distobuccal cusp, right? Next option was marginal ridges. Marginal ridges are mainly present at the margins near the mesial aspect and the distal aspect surrounding the fossa. In incisors you can see here mesial. On the mesial side it will be mesial marginal ridge, on the distal side it will be distal marginal ridge. Same way on the occlusal surface also. Just next to the triangular fossas, we have our marginal ridges based on the aspect, mesial or distal aspect. Buccal ridge mainly on the buccal aspect, starting from the cusp towards the cervical line. So I don't think now you will be having any doubt in the in this image-based question about transverse ridge and oblique ridge. Now coming to our next question. Stratum germinativum is a combination of. So what is the correct answer here? Is it stratum basal and spinosum? Is it spinosum and granulosum? Is it stratum granulosum and lucidum? Or stratum lucidum and corneum? So what will be the correct answer here? Yes, Pratik? Okay. It is? Yes, Ruby, Nami. It is stratum, basal and spinosum. Right? Nikesh, Manogna. Yes. So all of you are correct. What is germinativum? So it is mainly a combination of basal and spinosum. Right? So this is our epithelium. This layer is our basal layer. Right? Basal layer mainly has what? It can synthesize DNA and undergo mitosis and lead to the formation of new cells, right? Just next to our basal cell is our spinous cell layer. So the innermost layer of the spinous cell layer just adjacent to the basal layer is known as parabasal layer. So here you can see these cells. These are spinous cells which are present just next to our basal cells. Right? These are our basal cells and just next to that we have our layer of spinous cells. So these two layers together form stratum germinativum. Stratum germinativum. Right? So basal and parabasal together form stratum germinativum. In this diagram, we can easily appreciate these two together form stratum germinativum. Now coming to our next question, haplodont has single conical cusp, 3 cusp in a line, 4 cusp or triconodont. What is haplodont? Now this is again important phylogenetic classes of the teeth. There are 4 important phylogenetic classes of the teeth, which are that single cone, 3 cusp in a line, 3 cusp in a triangle and 4 cusp in a quadrangle. So the correct answer here is single conical cusp. Right. Am I audible? Okay. So here you can see it can come as an image-based question as well. You can be given this type of image and asked what is it. So it is mainly haplodont, which is single conical cusp. Single cone. Then we have 3 cusp in a line, 3 cusp in a triangle and 4 cusp in a quadrangle. Now coming to our next question, a transient structure which plays an important role in the shape of the crown during the formation of the tooth. So what are transient structures? These are mainly present in which stage? Cap stage. They are mainly present before the formation of enamel. So which are the transient structures? Enamel knot, enamel cord, enamel septum and enamel navel, right? Amongst this, which transient structures plays an important role in formation of shape of crown? That is enamel. What will be the answer here? Enamel knot. Yes, enamel knot. Why knot? Because it acts as a signaling center, right? It has many growth factors present which are expressed by the cells of the enamel knot and therefore it helps in determining the shape of the teeth. So mainly enamel knot. Enamel knot is present where? In this diagram, you can see here in the concavity of the cap. And mainly it acts as a reservoir of dividing cells as well as signaling center for many growth factors, as a result of which it helps in determining the shape of the tooth. So now coming to our next question. Again, I have seen in Telegram group, most of you have doubt regarding this odd-length bodies, right? That's why I have included this question here. So what are odd-length bodies and where are they present? Odd-length bodies are present in which layer? This is a most commonly asked question amongst the students. They have a confusion regarding the presence of the odd-length bodies. So what will be the correct answer here? Odd-length bodies are seen in which layer? Stratum granulosum, stratum spinosum, stratum basalis or stratum corneum? What will be the correct answer here? Stratum granulosum. So don't get confused. Odd-length bodies are present in stratum granulosum. They're present just above the stratum spinosum in stratum granulosum. So they're not present in stratum spinosum. They're mainly present in stratum granulosum. Right? Keratinosomes are mainly permeability barriers. Odd-length bodies. Odd-length bodies are what? Permeability barriers. And keratohyaline granules is a prominent feature of stratum granulosum, right? Ruby has a doubt in this. So, keratohyaline granules. We have the name itself, stratum granulosum. Stratum granulosum is why? Because of the presence of the granules. So, because of the presence of this keratohyaline granules, which are present in the stratum granulosum, they are the prominent feature of stratum granulosum. And odd-length bodies are permeability barriers. They are membrane-bound granules. So this is the main difference between the odd-length bodies and keratohyaline granules. Okay. And any other doubt? Nami had a doubt regarding enamel cord and enamel knot, right? Enamel cord is mainly an extension of enamel knot, vertical extension of enamel knot. So here we have enamel knot and this extension towards the outer surface will be our enamel cord. Okay. So I think Ruby's doubt is also clear. Odd-length bodies and keratohyaline granules. Both are a feature of stratum granulosum, but most prominent feature is keratohyaline granules. And odd-length bodies are mainly present in stratum granulosum, just above stratum spinosum. Next question. It is again an image-based question. Concentric dark bands or lines present in enamel are. They are striophragzious, Hunter-Schreger bands, imbrication lines or neonatal line. So what will be the correct answer here? Here we can see the presence of line. What will be this? Dark brown bands we can see here. So the correct answer here is what? Striophragzious. These are striophragzious. So you can see the presence of dark bands. These bands depict what? Successive deposition of enamel. Concentric dark bands depict the successive deposition of enamel. So they are mainly, striophragzious are what? Incremental lines of enamel that depict successive deposition of enamel. In transverse section, they appear concentric. And there may be broadening of the lines during the metabolic disturbances. Now coming to our other options, you can be asked an image-based question. So here you can see light and dark bands. These are Hunter-Schreger bands. Light and dark bands. Dark bands, diazones, light band, parazones. Again, this is what? Perikymeta, surface structure of enamel, right? They are external manifestation of striophragzious. And coming to our next question, option, that is neonatal line. What is neonatal line? It is the line separating prenatal enamel from the postnatal enamel. It is again an accentuation or more prominence of incremental line of enamel, right? So it is more accentuated incremental line. Coming to our next question, which is again an image based question. Identify the stage of tooth development in this image. What will be the correct answer here? Can you identify? Is it bird stage? Is it cap stage? Is it bell stage? Or is it advanced bell stage? Anyone? What will be the correct answer here? So here you can see that we have formation of hard tissue, right? We have formation of hard tissue here. So as we have formation of hard tissue, what will be the correct answer? We have discussed in our live lectures as well as recorded lectures that hard tissue formation is mainly seen in which stage? Advanced bell stage. It is mainly seen in advanced bell stage. Right. So in this also you can easily appreciate enamel and dentine formation. So in advanced bell stage, through reciprocal induction, we will have the formation of enamel and dentine. Under the influence of inner enamel epithelial cells, dental papilla cells differentiate into odontoblast and they form dentine. Once dentine is formed, again they send signal to ameloblast cells and they will start forming enamel. So first formed hard tissue is what? Enamel or dentine? Dentine. Now coming to our next question. The cell shown in the picture is found usually in the basal layer of the epithelium of oral mucosa. These cells are few in number, present adjacent to the myelinated nerve endings and contain fluid-filled vesicles. Identify the cell. Again, an image-based question. So this is from which topic? Oral mucous membrane. So can you identify the cell here? It is written in the question itself. It is present in the basal layer and just adjacent to the nerve fiber. So this is mainly from the option we can see that these are what? Non-keratinocyte cells. These are what? Non-keratinocyte cells. So which non-keratinocyte cell is this? Just adjacent to the nerve fiber. It will be Merkel cells. Why? Merkel cells are mainly pressure receptor cells. They are pressure receptor cells present in the basal layer just adjacent to the nerve fiber. So they are pressure receptor cells derived from the neural crest cells. And they are non-dendritic cells, while melanocytes are dendritic cells, melanin forming cells. Langerhans cells are antigen presenting cells. So these are what? Mainly pressure receptor cells. Now coming to our next question. Again, I think some of the students had the same doubt how to identify the side of the teeth, right? So the given tooth is from the option, is it permanent maxillary right first molar, permanent mandibular right first molar, permanent maxillary left first molar or permanent mandibular left first molar? So what will be the correct answer here? So first you should identify which is the mesial side and which is the distal side of the tooth. So here we can see first of all, we can see there are 5 cusps here. 1, 2, 3, 4 and 5. So which molar has 5 cusps? It is mainly maxillary molar or mandibular molar? Mandibular molar, right? So mandibular first molar has mainly 5 cusps. So it is mandibular first molar. Now we will determine the side. Amongst the 5 cusps, which is the smallest cusp? Distal cusp. So distal cusp is present on the distal aspect. So definitely this is our distal side, right? And this is our mesial side. So we have identified the mesial and the distal aspect. Mesial side should be always towards the midline. So imagine this tooth within your own oral cavity. This cusp should be facing the buccal side, right? And this towards the tongue. So by placing it on left side, what will happen? Its mesial aspect will be facing. Don't imagine it in the tooth numbering system quadrant. Just imagine within your own oral cavity. So if the tooth is placed this way, the buccal side is coming buccal side and lingual is coming lingual. So it is proper, and mesial aspect is towards the midline. This is our midline and mesial aspect is towards the midline, definitely. So as the mesial aspect is towards the midline, it is of which side? Left side. It is of left side. If on right side we place this tooth, then what will happen? Distal side will be facing towards the midline, which is not proper. So definitely it is not of right side, it is of left side. So the correct answer here is permanent maxillary or mandibular, permanent mandibular left first molar. This is the correct answer. Because of the presence of 5 cusp, mandibular, and on determining the side, always remember mesial aspect towards the midline. So if we place on left side, definitely our mesial aspect is facing towards the midline. If on the right side, it will not be facing towards the midline. So the correct answer is left side. Now coming to our next question. Enamel spindles are, they are enamel rods formed linearly by successive opposition of the enamel, or their odontoblastic process that cross DJ into the enamel, or their enamel rods that cross the DJ into the dentine. Hypomineralized structure of enamel rod that project between the adjacent groups of enamel rods from DJ. So what will be the correct answer here? They are mainly odontoblastic processes that cross DJ into the enamel. Here we can see this is our dentine, this is our enamel. So odontoblastic process cross D, and this is our DEJ, dentino-enamel junction. So odontoblastic processes cross DJ and enter enamel. These are enamel spindle. They are thickened at their ends. So mainly they are end process of odontoblastic process crossing DJ and entering enamel. Mainly in ground section, they are contain what? Organic material which will disintegrate and it will be replaced by air, as a result of which they appear dark. Tooth with Y-shaped groove on occlusal surface. Is it permanent mandibular first premolar? Is it permanent mandibular second premolar? Is it permanent maxillary first premolar? Or is it permanent maxillary second premolar? Now, Y-shaped groove. Y-shaped groove. So, Y-shaped groove is a characteristic feature of which tooth? Permanent mandibular second premolar. Why? Because this premolar has 2 patterns. It has 3 cusp pattern or it has 2 cusp pattern. So in case of 3 cusp pattern, we have Y groove. While in case of 2 cusp pattern, we will be having H and U groove. Right. Okay, good. So Y shape with 3 cusp pattern and H and U with 2 cusp pattern. So this is also an important question. It was asked one to two more than one time. It can be asked which pattern except the 3 of the option is not a pattern of mandibular second premolar. So it can be asked H, U, Y or V. Which of this is not a occlusal pattern of mandibular second premolar? So V will be the pattern. We have H, U and Y as occlusal pattern seen in mandibular second premolar. Here you can see U we have for 2 cusp, H we have for 2 cusp and Y we have for 3 cusp. Right? Now coming to our next question. Elevated occlusal portion of the tooth which forms the developmental groove is called. So it is asked elevated portion. Is it ridge? Is it cusp? Is it fossa? Or is it tubercle? Ridge is definitely an elevation. But it is not formed by the developmental groove. So this is not the correct answer. Coming to cusp. So cusp is definitely an elevation, right? And it is formed by the, which forms the developmental grooves. So here what will be the correct answer? Yes. What will be the correct answer? Cusp. So fossa is what? It is a depression. So again fossa is not the correct answer. Coming to tubercle. Tubercle is also an elevation, but it doesn't form developmental groove. It is formed by extra deposition of the enamel. So again tubercle is also not the correct answer here. So coming to cusp, here we can see cusp and in central portion we can see developmental groove. So mainly it is an elevation on the crown portion of the tooth making the divisional portion of the occlusal surface. Tubercle elevation but because of the extra formation of the enamel. Ridge, it is again an elevation but it is named mainly based on the location. Fossa, irregular depression or concavity. Now again recently in one group someone had asked regarding the acini. So I have included this question. Identify the type of acini marked in the histologic picture given below. Is it mixed? Is it diminules? Is it serous acini? Is it mucous acini? So what is the correct answer here? And someone had asked me to add the histologic slide for this also, right? So what is the correct answer here? Can you see? Is it darkly stained or is it lightly stained? Based on that, you can differentiate in histologic picture. Right. C. Akshat, Nikesh, Harmandeep. It is lightly stained. So it is mucous acini. And you can see the nucleus present at the periphery. Flattened nucleus is present at the periphery of the cells. Right. So correct answer is mucous acini as it is lightly stained and you can easily appreciate the presence of flattened nuclei at the base. Now the difference between serous cells and mucous cells. Can you differentiate based on the images? Serous cells will be darkly stained in acini stained section while mucous cells will be clear or lightly stained in acini stained section. They can be stained with pus or Elchian blue stain, mucous cells. So don't get confused. Whenever you see a darkly stained acini, it is serous acini. And when you see a lightly stained acini, it is a mucous acini. Now coming to diminules, serous diminules. What are serous diminules? They are half moon shaped serous acini present over the mucous acini. So in this image, can you appreciate the serous diminules? Here you can see this is our mucous acini and this portion, this darkly stained half moon shaped is our serous acini. So half moon shaped serous acini seen over the mucous acini are our deminules. Serous deminules. So you can be asked an image based question on this also. You can be asked this, an arrow mark can be shown and you have to identify the structure. So it is half moon shape, you can see present over the mucous acini. So it is definitely serous deminules. So this is an histologic picture. Again you can see these are our mucus cells. And where are the serous acini? Here. Can you see? Darkly stained are our serous acini. So clearly you can appreciate the difference between serous and mucous acini in this slide. Right? Now coming to our next question. Major fossa in maxillary first molar is? Is it central fossa? Is it mesial triangular fossa? Is it distal triangular fossa or lingual fossa? So what will be the correct answer here? Major fossa in maxillary first molar. So first of all, how many fossa are present in maxillary first molar? Fossa is a depression, right? So how many fossa? Two major fossa, two minor fossa, right? So which are the major fossa in maxillary first molar? Central fossa and distal fossa. Yes. Good. Satish, Nami, Libra, Nikesh. It is central fossa. So there are two major and two minor fossas in maxillary first molar. Minor are which? These are our minor fossas. Mesial triangular fossa and distal triangular fossa. And central is our major fossa. Central and distal. Good. Now coming to our next question. Trapezoid outline of incisors suggests their similarity in class trait, arch trait, set trait or type trait. What are traits? Traits are difference between different classes of teeth, right? Yes. So, they are mainly the difference between different classes of the teeth. So, what is set trait? Set is difference between deciduous and permanent dentation. So, definitely we are talking about incisors only of one dentation. So, set is not the correct answer. Arch trait, maxillary and mandibular. So, again, this is not the correct answer. Coming to type trait. Type is difference between central and lateral incisor. But here we are seeing the question is similarity, right? So the correct answer is class trait. Incisors belong to same class. Incisors belong to same class. Canine, different. Premolars, different. And molars. We have three classes of teeth. Incisors, canine, premolars and molars. So difference between this is our class trait. Difference between incisor and canine, incisor and premolars. But here in this question you can see that trapezoid, incisors are trapezoid. So they are having the similarity. So they belong to the same class, right? That's why the correct answer here is a class trait, as it is asked about the similarity, not the difference between central and lateral incisor. So incisors being central or lateral are having similarity in their trapezoid outline. That's why the correct answer is class trait. Right. Coming to our next question. Amyloblasts are originated from ectoderm, ectomesenchyme, endoderm or mesoderm. What is the correct answer here? Yes. Ectoderm is the correct answer here. Why ectoderm? Which Structure of the tooth germ forms enamel. Ameloblasts are what? Enamel forming cells, right? So which structure form enamel? Enamel organ, and enamel organ is ectodermal in origin. All the tissues of the teeth except enamel are derived from neural crest cells, while enamel is derived from ectoderm. So remember this, all the tissues of the teeth except enamel are derived from neural crest cells, that is ectomesenchyme. Yes, Nami wants to know about minor fossa, right? Minor fossa are mesial triangular fossa and distal triangular fossa. No, Nami. Mesial triangular fossa and distal triangular fossa, not lingual. I will show you. Mesial triangular fossa and distal triangular fossa. Okay, I am getting question answer for next question also. Keratinocyte cell migration from basal layer to the superficial layer is called. Is it maturation? Is it proliferation? Is it migration? Or is it differentiation? Yes, Nikesh. Because ectomesenchyme is mainly derived from neural crest cell. So rest other tissues you can see, right? Odontoblast cells are what? They are derived from dental papilla. Dental papilla again is an ectomesenchymally derived structure. Okay, Nami, distal triangular fossa is different and distal fossa is different. Distal triangular fossa we will see just adjacent to our distal marginal ridge, and distal fossa is our different fossa. Distal triangular fossa and mesial triangular fossa. Mesial triangular fossa just adjacent to the mesial marginal ridge. So this both triangular fossas, mesial triangular and distal triangular fossas are minor fossa, and distal fossa is different compared to the triangular fossa. Distal and central are the major fossas. Okay. So keratinocyte cell migration from the basal layer to the superficial layer is called what? Is it maturation? Is it proliferation? Is it migration? Or is it differentiation? So correct answer is maturation. So usually cells migrate from the basal layer towards the superficial layer, right? So this process of migration from the basal layer to the superficial layer is maturation. Right? Okay, Nami, we'll discuss this after I complete this question. We'll discuss about the fossa again. Just we will complete this question, then we'll come again to the fossa question. So process of migration from basal layer to the superficial layer is known as maturation. Now time taken for this process is known as turnover rate. This migration of cell from the basal layer to the superficial layer is turnover rate. Now what is differentiation? During this migration, the cell may pass through single layer. Every layer, it passes through every layer. So in each layer, it becomes determined and it becomes committed to biochemical and morphological changes. The shape of the cell will change as well as its metabolic activity will change. So it is known as differentiation. So during migration, keratinocyte cell becomes committed to biochemical and morphologic changes, and it is termed as differentiation. So this is the difference between maturation and differentiation. When the cell becomes committed and you can see the changes, biochemical changes as well as morphologic changes, that will be differentiation. Okay, now Nami had a doubt. So don't get confused, Nami. Maxillary, first molar. So these are our marginal ridges, right? Here we have this triangular fossa. So this triangular fossa, on mesial side it will be mesial triangular fossa, on distal side it will be distal triangular fossa. Centrally we will be having central fossa, and here we will be having distal fossa. I will share the diagram for occlusal aspect in our Telegram group also if you have any doubt regarding that. Okay. Now coming to our next question. Mesial marginal developmental groove is present in, is it permanent maxillary first premolar, is it permanent mandibular first premolar, is it permanent maxillary first molar, or is it permanent mandibular lateral incisor? So it is asked mesial marginal developmental groove. So what is the correct answer here? Permanent maxillary first premolar, right? This groove extends from the mesial marginal ridge from the occlusal surface. This is important feature. You can see here. Crossing the mesial marginal ridge, here we have a groove extending towards the middle third of the crown. So this is our mesial marginal developmental groove, which is a characteristic feature of permanent maxillary first premolar. On the root also you can see a depression present, that is mesial marginal depression, mesial developmental depression. Mesiolingual developmental groove is present in which tooth? Mesiolingual developmental groove is present in which tooth? Mandibular first premolar. Now coming to our next question. Type of collagen present in von Korff's fibers. So which type of collagen is present? Is it type 1, type 2, type 3 or type 4? So what is the correct answer here? Yes. C. Type 3. Mainly mantle dentine is composed of type 3 collagen fibers, which are agrophilic fibers, and they are known as von Korff's fibers. They are von Korff's fibers. They are larger diameter fibers mainly, and they are perpendicular to the dentino-enamel junction. Yes. Now coming to our next question. What is the age of the child whose OPG is shown in the image below? Is it 9 years? Is it 10 years? Is it 11 years? Or is it 12 years? Now this image based question is also very important. So what will be the correct answer here? First you should look out for which tooth have erupted, right? So central incisors, maxillary and mandibular both central incisors, lateral incisors as well, maxillary and mandibular lateral incisors. Coming to canine, no, permanent canine have not yet erupted, and our first molars, right? So amongst this incisors and molars, which one is the last tooth to erupt? Which tooth is the last tooth to erupt here? Based on that, you will get the age of the patient here. Always remember, whenever such image based question is asked, look out for the tooth which is the last tooth to erupt here. So here we have which tooth? Maxillary lateral incisors. Maxillary lateral incisors. So what is the eruption timing of maxillary lateral incisor? It is 9 years. Yes, canine, permanent canine have not yet erupted here. In this diagram, you can easily appreciate it is similar diagram for the radiographic image. Here you can see central incisor, lateral incisor, maxillary central incisor and lateral incisor. Canine have not yet erupted. These are deciduous canine. Yes. So the correct answer here is maxillary lateral incisor, and eruption timing for maxillary lateral incisor is 8 to 9 years. So the age is mainly 9 years here. Any doubt in this? So this type of question can come. Once it was shown and a radiographic image was shown and you were asked about the succedaneous teeth. Which are the succedaneous teeth here? Right? Now coming to our next question. Line of demarcation in bone remodeling is it rest line, is it reversal line, is it line of Salter, or is it neonatal line? Now, in the line of Salter is what? Incremental lines of cementum. So definitely it is not in bone remodeling. Neonatal line, we have recently discussed. It is a accentuation of incremental lines of enamel, separating the prenatal enamel from the postnatal enamel. So again, this is not the correct answer. So the correct answer here is reversal line. Good. So what is reversal line? Mainly, it is present at the site of change. During bone resorption, what will happen? After bone resorption, bone deposition will be there. During this transitional phase, this line will be present. So the site of change from bone resorption to bone deposition is marked by a scalloped line. Here we can see scalloped line. This scalloped line is our reversal line. Coming to resting line, it is mainly resting phase, quiescent line. Deposition of bone with periods of rest. So during rest, resting line will be present. Here you can see parallel vertical lines. These are resting lines. Right? So resting line also we have discussed, and we have discussed about the reversal lines. Coming to our next question and last question. Cemental repair to re-establish the root outline is known as. It was asked in recent NEET. Is it functional repair? Is it physiological repair? Is it anatomical repair? Or is it pathological repair? What will be the correct answer here? Re-establish the root outline. So it will be mainly anatomic repair. From the word itself, you can say anatomy of the root is established. Anatomy of the root is established here. Yes. So what is anatomic repair? Usually the resorbed area, here you can see the resorbed area. This resorbed area will be filled with cementum to maintain the anatomy of the root. So resorbed area will be completely filled by cementum, and continuity of the root surface will be re-established. While in case of functional repair, what will happen? Some portion will be filled by cementum so that the normal functioning of the tooth can take place. Not whole defect will be filled by cementum. Only a small portion will be filled by cementum. Rest will be filled by alveolar bone. Right. So in functional repair, what will happen? Resorbed area will be partially filled by cementum, resulting in a bay-like defect. Partially filled by cementum. And rest is occupied by alveolar bone. Alveolar bone forms bony projection to re-establish the normal physiologic width of periodontal ligament. Right. So here the correct answer will be anatomic repair. So we have completed with our today's important discussion for previous year questions. I think during this class, some of your doubts are cleared. So all the best. Keep going. Good night. Thank you.